Hi, everyone. This is Pastor Josh here, and I have Dr. Alex Ding joining us today. We're going to call this the special COVID-19 episode. So I hope you all enjoy it. Alex, thank you for being here and agreeing to being interviewed by me. I really appreciate it.
Absolutely, my pleasure. I'm happy to be able to do whatever I can to help out our community, and I really appreciate the chance to be able to talk to everyone. And thank you, everyone in advance for the questions I've posted. I think they're really good questions. I look forward to trying to address them the best I can.
Great. So let's first talk just a little bit about you.
Sure.
Where are you from?
So I, for the most part, am from the Bay Area,
Okay.
but I was born in Germany, which is how I became Lutheran in the first place.
Well, I don't think I knew that.
Yeah.
So you were born in Germany, and when did you move to the States?
So I moved to the States. I moved to California in grade school. And one of the first places that my parents looked to take us to was a Lutheran church when we first moved here. And I've been with the Lutheran church ever since.
That's really cool. Do you speak any German?
Ambition.
Ambition?
No, ambition, a little bit.
A little bit.
Yeah.
Oh, so that was German.
That was German.
I speak no German.
So I can probably speak at the level of elementary school kids. So I can get around, do things I need to do if I had to go to the grocery store or go to the train station, but anything more sophisticated than that, no.
Okay. And where did you, and so you're a doctor, you're an
Yes.
MD?
I'm an MD, yes.
And where did you go to medical school?
So I went to graduate school at Berkeley in public health, and then I did medical school at the same time at UCSF. And then I did my internship in general medicine and surgery at Santa Clara Valley Medical Center in Stanford. And then I moved to Boston, where I did my residency in diagnostic radiology and my fellowship in interventional radiology at Harvard Medical School and the Mass General Hospital.
Right on, right on. And you're doing a degree right now too, right?
I am. I'm finishing up my MBA at Wharton, which should be done in May.
You know, you hear about these guys who are like Navy SEALs who become doctors and then astronauts, and I kind of feel like you're one of those people because you're like a doctor. You were banking before this, right?
Pardon?
You were a banker, weren't you? Didn't you?
Yes, that's right. That's right.
That's awesome.
That guy you're talking to, I actually know of. He was also at the Mass General, and so he's a hero of mine. So I appreciate you connecting me with him.
That's so great. That's so awesome. And you are also married?
I sure am.
And you have 2 children, right?
Yeah. So I'm married. My wife is Kimberly, who I think everyone in the congregation knows. We've been married going on 11 years now, and we have 2 young boys, 5-year-old and a 3-year-old, Lucas and Liam.
Awesome. And right now, because you're working in a hospital, right?
Yeah, so I cover multiple hospitals in the area, not just one, and it's basically the nature of my practice where we try to. The limited resource is the specialty doctor, and so rather than have us at one specific site, they try to get us out to as many places as possible.
Because you are working in hospitals, you are quarantining yourself, right, away from your family. Do I have that right?
Well, so I'm not quarantining myself. I haven't been officially exposed to the point where quarantine means you've actually been exposed and you should be segregating yourself out from the regular population. So I do see patients that are either persons under investigation or people with positive COVID status. And so even though I'm wearing protective gear during those times, I know that there's sufficient exposure where I'm just not willing to risk my family with that exposure. And so it's officially more like a self-isolation, but yeah, I'm living upstairs by myself as a bachelor, and I get left some food on the doorstep every now and
then. That's funny that you say that, but I'm so sorry that you have to be away from your family right now.
Well, I appreciate you saying that. It is very tough, but I think we really want to play it safe. And the last thing we want is for anyone else to get sick who doesn't need to be.
For sure. Uh, okay, one last question before we talk about COVID-19. Do you have any hobbies or passions?
Yeah, so one thing that my family and I really enjoy doing, unfortunately, is on hold given the COVID pandemic, and that's travel. We really love to travel, and one of the things I really am trying to do with my kids is really showing them kind of the diversity of what's out there in the world so that they understand that there are a lot of ways to do things. There are a lot of different perspectives in which to look at things. And so we think it's really nice to be able to get out of your comfort zone and to be able to see kind of the amazing things that are out there in the world. And unfortunately, while we've had some major plans for the next several months, those are all on hold because of obvious reasons.
Right, for sure. Uh, well, that's really cool. All right, let's talk about this pandemic, man. This is crazy. I mean, we are living in a time that I don't know anybody. Would it be fair to say anybody alive has gone through a pandemic like this before?
Yeah, I think there have been several pandemics in our lifetime, but I would say this is unprecedented compared with all of those. So, more recently in the world, it hasn't really affected us at home nearly as much as we're currently seeing with COVID, and that is MERS and SARS, and then of course the HIV epidemic, which
Mm.
occurs at, even though it's been occurring kind of in a pandemic sort of way across multiple continents, the time frame in which it happens and the way in which it's transmissible is completely different than COVID. And so it's somewhat of a different nature. But you're absolutely right. I think this is unprecedented in any of our lifetimes that we've seen. I would say you'd probably have to go back to the Spanish flu of 1918 to really see the same sort of scenario.
And yeah, since you're working in a hospital right now, how do you think the level of what is it called? PPE? Is it personal protective equipment? Is that what that's called?
Exactly,
Uh,
exactly.
how is that going?
So unfortunately, I would say that's one of the main areas um, of concern that I have currently. I think that not just at my own hospitals, but including my own hospitals, but you'll see nationally there is just a shortage of PPE or personal protective equipment. This is basically the stuff we don to minimize infection of healthcare workers, but also to prevent us from basically getting infected and transmitting it to other people. So these are very basic things. These are not that special things. These are things like face masks and goggles and gowns and gloves. And all of those things we are quickly running short on. And so um, one plea that I would have is if anyone has anything that they have saved up from, construction work, for example, is a good place where you can find some PPE. Even though they may not be medical grade, I think at this point, we would be very happy to take those as donations and would encourage that if anyone has any of that lying around. And I know that there have been several members of our congregation who have reached out and have made those donations. And to those people, I really want to thank them here publicly and acknowledge that.
Oh, and what is you said you were working with some people who had been exposed or were under investigation of having COVID-19, and so uh, you yourself have been potentially exposed to this. Is this right or?
Yes, so there are two parts of what I do in my day-to-day job, um, which which kind of align with the things that are happening in COVID. One is the diagnostic side of things. So diagnostic imaging is something that I do. And one of the things that we get on just about every patient who comes in that has suspected COVID is a chest x-ray. And so all of my staff who are out there taking these chest x-rays are exposed. And then sometimes the test does not have the best testing characteristics. And so there's a decent amount of false negatives that can happen. And so one of the things that can be a problem solving tool is if a clinician thinks that this patient sure is acting like they have COVID, but their test is negative, they can get something like a CT scan and take a look and see if that may help elucidate what's going on. And then the other side of what I do is interventional radiology. So that's minimally invasive image-guided surgeries. And in those instances, I spend a lot of time sticking needles in people's lungs and tubes in people's chests. And those are all things that we consider aerosolizing procedures. So these are things that can make people cough and really get more virus out into the environment. And so in those instances, the PPE is particularly important to have.
Wow. I know one of the people who was asking about PPEs, they said that it says biotechs are repeatedly contacted to donate supplies to UCSF and Stanford, also contacted to donate RNA extraction kits and swabs. What is that?
Yeah, so I would say that the need is there across the board. So I certainly appreciate that UCSF and Stanford need PPE, and I don't want to take away from that, but I want everyone to remember that it's every single hospital that is out in the community that needs it as well. So that in our area, that includes the Kaiser Hospital, Sequoia Hospital, Mills Peninsula, San Mateo County, Seton. And so I want to make sure that we remember all of them as well, and make sure that whatever sorts of donations we can make, we try and spread it around. But yeah, in regards to basically running low on everything, nasal swabs are what we use to do the test. So they basically stick a nasal swab in the back of your throat or in the back of your nose to get some of those secretions and run the tests on. Unfortunately, because we are doing so many tests, we are running low on nasal swabs as well. And then the other thing that is a major limiting aspect here is that we just do not have enough testing capability and capacity as we really need. And one thing that we can do to expand that is to provide some of the reagents that are out there, which is what those RNA extraction kits and other sorts of reagents that the laboratories might need to be able to expand the capacity to run the testing.
Thank you. That's really interesting. Did somebody else asked about lung X-rays or other scans? Are they so? This is not a word. I don't understand this question, but I'm sure you do. Are lung X-rays or other scans sufficiently differentiated for COVID-19 to use as a presumptive diagnostic? This sounds like somebody who works in the medical field understands.
Yeah, that's a really good question. And when we first started seeing what COVID looks like on imaging, that was a major question that we asked. And it turns out that the appearance on both chest X-ray and CT scan is fairly what we call non-specific. So it might be present, but the chance that it could be COVID or something else is pretty high. So other things can also look and have a similar appearance. So things like just plain old pneumonia can sometimes look that way. And there are other sorts of infections that are not COVID that can also look the same way. But what it can do, as I mentioned, is there are people that, for all intents and purposes, look like and act like they have COVID, but their testing is negative, in which case this might be helpful for identifying those individuals who've had what are presumed false negatives. The other thing it could help with is if a doctor is considering different and alternative diagnoses for what might be causing a patient to present with similar symptoms, this can help determine whether it is some of those other diagnoses as opposed to COVID itself.
Interesting. Thanks.
So the main I think the main takeaway is that while those tools are helpful, they're not intended to be screening tools for determining COVID status, but they can be helpful for determining alternative diagnosis and for clinical problem solving.
Yeah, thanks. One of the, just to go slightly back to the PPE and somebody else asked it, it seems like there's going to be a big wave of illnesses that are supposed to just sweep the hospitals. How are you all prepping for that?
Yeah, so this is definitely something that we're expecting, and I think if you watch the news of what's happening in New York, for example, I think you'll see that they probably still not have hit the top of their wave yet. And so it's incumbent upon us here, while we still have a little bit of time, to basically do whatever we can to what people say as flatten the curve. And that's basically all the things that everyone out in the community is doing to play their part, which are things like social distancing and practicing good hygiene, which is basically to try to buy us enough time that we can manage the number of patients that are going to come in for critical care services. On the other hand, those of us in healthcare are basically trying to expand for our surge capacity to the extent possible. So for example, at some of the hospitals I'm at, most of what we've been doing in the last couple of weeks has really been preparing and making sure that we've got the equipment that we need, the workflows and process, and the staffing to meet this anticipated surge. And so for the sites that I cover, we anticipate that we can probably expand capacity to about 200% of normal to meet this impending wave.
Wow, that's it's impressive. I wouldn't have guessed to do 200%. That's amazing.
And then there are other things that the state is doing, which I think is really beneficial to really help expand that as well. So I think some people have seen in the news that the USS Mercy has pulled into the Port of Los Angeles to provide additional capacity. In our county, Seton Hospital was planned for being probably being shuttered due to bankruptcy. This week or two, Governor Newsom has basically come in and leased up the hospital for a long-term lease and try to staff it up. And I think they've opened up an additional 180 beds on top of kind of what is currently out there. And so they're shoring up hospitals that were either struggling and not seeing as many patients as they could, but they're also opening up new facilities and capabilities as well. So for example, in the city, with the new CPMC campus opening, there were a couple of the older ones that had shut down, but the plan is to reopen some of these to be able to provide additional capacity as well.
Wow. People have been talking a lot about the president said something about cures or stuff that would be helpful for it. Is have you heard anything? There's one person who asked, I heard that the same RX that is prescribed for lupus, which they currently take, which is hydrochloroquine, aka Plaquenil. I don't know if I'm saying that right, but
close enough.
What's the verdict on this kind of stuff?
Yeah, I mean, I think there are a lot of people trying a lot of different things, and I think in a time of crisis, that's important and necessary. But I think we have to do it in a measured way and in a way that still remains relatively safe. And so, for the drug that the president mentioned, which is chloroquine or hydroxychloroquine or Plaquenil, there is some preliminary evidence that it may be helpful, but I think it's not conclusive evidence by any means. And I think regardless of what the treatment is that might be worthwhile trying, I think the most important thing is that they're done under the prescription and supervision of the physician. So for example, this medication is not without its side effects. Actually, one of the well-known side effects is that it causes cardiac arrhythmias and can cause to sudden cardiac death. And so you want to make sure that if this is something that is recommended for you, you're doing it while your cardiac status is being monitored by a doctor, so that if the side effect is noticed, it's noticed early before anything untoward happens. And so I think with any sorts of treatments, there are probably going to be some side effects. And I think in a time of crisis, we may not need the same sort of level of evidence to try these medications, but I think they still need to be done with proper supervision and not just, for example, bought off the internet and just tried on your own.
Yeah, thanks for saying that. Have you heard anything about, like, if somebody's received a pneumonia vaccine, if that is helpful in not contracting this?
So I think still getting the flu shot is still important. I think getting any sorts of vaccines probably are still useful because what they can do is they can reduce the chance you get any sort of co-infection with anything else. And then, for example, the other thing is, so for the flu, for example, there's a lot of crossover between the symptoms that COVID presents with and with the standard common flu. And so I think if you're able to basically take a vaccine to at least try and mitigate the risk of one of them as much as possible, there is a benefit to that.
Yeah, for sure. All right, there's been a lot of fiction that is out there, and is there anything that you've heard that you want to say, like, this is pure fiction, this isn't true at all? I think one of the things that I've heard is, and I don't know if this is fact or fiction, but maybe it was a passing statement of doctors implementing universal DNR orders for this, and I don't know if that's true or not. But what have you heard that's fact or that's fiction out there that we should just clear up right away?
Yeah, I mean, there's not one particular story that I can reference, but I would say there's a tremendous amount of misinformation, and I think it's causing a lot more anxiety than needs to. And I think it's very difficult to be able to separate out the fact from fiction. And I think, if you have concerns, the best thing to do, especially if it's with regard to your own with your own health, is not to rush into the emergency department, but actually to call your personal physician's office. So I think at this point, most doctors' offices have recognized the importance of being able to use telemedicine to be able to essentially do what we're doing and basically have a FaceTime or Skype visit to talk to people, to either help with a diagnosis, to give them advice, or to kind of talk them through any sorts of concerns that they might have. And so that means you don't have to show up to the office, but there you can trust that the information that you're getting, if you're really concerned about something, is either true or not.
Uh-huh.
I think it's important to take everything with a grain of salt that's not coming from an official channel or a trustworthy media source, that it might just be misleading.
Thank you for saying that. Speaking of trusted channels, I know that I've been looking every day at the San Mateo County Health page that says the number of people with confirmed cases and the number of deaths. Do you think that's anywhere near the real count for our county? Is that how do you think the testing is going in our county?
Yeah, that's a great question. I would say the numbers that are officially reported on the website are the official numbers. So these are what I believe to be trustworthy figures. However, that having been said, I think there are a lot of cases that are not being accounted for. And a lot of that has to do with the limited testing that we currently have in this country. So the threshold in which we've set for people to actually get tested is fairly high. And so that means a lot of people with either asymptomatic COVID infections or very minor symptoms are not being tested. And so I think that the actual number of people that have it out in the community it's probably 1% to 2% of the population. And so that's the main rationale for why it's important to practice physical distancing. In that you can assume that if 1% to 2% of the population has it and they're just not that sick, they can still transmit it fairly easily. But that for every 50 to 100 people that you interact with, there's a chance that you're going to contract COVID. And so to minimize that contraction rate, we minimize the physical interactions between people at a close-up level.
And to go along with that, how risky is it for us to be getting food from restaurants, picking up food from restaurants, or having it delivered containers that the food comes on, even going to the store when we touch something that somebody else has touched. What's the risk level there for us to get it that way?
Yeah, so I would say the risk is low, but the risk is not, it's not zero. And so I think, given the tough economic challenges that everyone is facing with the pandemic, I would encourage all of us to be able to patronize our local businesses to the extent that we can. And I think doing takeout with restaurants is a good way to do it. And I have faith that those in the restaurant business have been practicing good hygienic practices. And so I think the risk there is going to be minimal. I think going out to the grocery store is also low risk, but it's a little bit higher. And that's because, you can't always trust that everyone's not going to not sneeze into their hand and touch a bunch of packages. But that having been said, I think people are still fairly conscientious about things. I think the stores are really stepping up and trying to practice as good sanitary and hygienic practices as possible. I would encourage, if you're going to go out, to bring some wipes and just wipe down the cart, wipe down your cart, and some of the items that you pick up. You can just do a quick wipe down of those as well before you bring them in the house. But so I would say you can still do all of those things, and these are all necessary things. Everyone has to eat, and so keep doing those. For the most part, they're safe activities. Just practice good hygiene, and while you're doing it, practice good physical distancing as well, especially when you go to the grocery store.
I know that even when I get I've gotten a couple Amazon packages, I've just opened it outside and brought the package, what was in the package, inside my own house, and then washed my hands. And then I was like, I don't know what else I could do.
Yeah, I mean, I think right now, erring on the side of overcaution is going to be the right thing to do. And even if the risk is almost going to be zero anyways, even if you do that, it's not going to cause any sort of harm. So I don't think there's a problem with that at all.
And I think that this conversation, maybe the question that I should have asked earlier, is transmission of this. What does transmission look like? How is it transmitted?
So it's through droplets that are formed when you cough or sneeze. And so this is a virus that usually lives in the back of your nose and the back of your throat, and then down in the lungs as well. And so anything that kind of interfaces with secretions from those areas is how this is transmitted.
And how long does it live on surfaces for?
So I think that's hard to say. And there's some data that shows it can be hours, even longer. But I would say it really depends on what the air exchange is in whatever area that you're in. So if the air movement through an area is good, it's going to be a short amount of time. If it's stagnant air, it might be for hours, half a day, if not longer. So it really depends on that.
Yeah. Well, thanks. Let me see what other questions I have. I think that's about all the questions that people have asked. I think we went through them all. Is there anything else that we should be knowing? What haven't I asked yet that I maybe should have asked?
Yeah, I mean, I really think these are excellent questions. So I want to thank the congregation for being so thoughtful about them. If there are other questions that come up, I'm happy to answer them offline or in another session as well. But the main message I would leave this with is that this is really a serious pandemic, and I think it's really important for us to take very seriously. As we mentioned before, this is unprecedented, and so it really requires everyone banding together to get us through this. And so for everyone that's out in the community, we've all heard about the importance of social distancing, and I think that probably is not the best term, because I would say really the best way to think about it is physical distancing.
Yeah.
And one of the things I don't want people to think is that social distancing doesn't mean that there should be social disengagement.
Yeah.
And I think people are starting to recognize that, and it's really important that when you're physically isolated, the best way to get through it is that you still maintain your community and still reach out to your neighbors and make sure that everyone is doing okay. And for that reason, I really think what the congregation has been doing and reaching out to all of our congregation members and really trying to keep this community connected and going. And for that, I thank you and I thank the congregation. I really think that's the most important thing that I can ask all of the community members to do.
Well, I think that's where we should leave it. So thank you so much for allowing me to interview you.
It's my pleasure. Thank you so much for your time.